guys, Coach Scott and Coach Joe here for our weekly interview with, there's a new face in our crowd. This is Dr. Greg Johnson over at Kinetic Sports and Rehab. He is Stoneway CrossFit's chiropractor, so whenever we have any issues, he's our guy that we go and see. And so, Greg, thanks for being here with us on our talk show. First guest ever. Greg, give us a little introduction about you, who you are. We already told you where you're from, so.
Yeah, I'm at Kinetic Sports Rehab. We've chiropractic sports med clinic that's got 3 locations now in Seattle area and one up in Woodinville. I work at the Fremont location, and these guys know that's just across the way from Stoneway here. What we do is focus on a lot of sports and soft tissue injuries, catering to a more active patient base, but also seeing people that are, average Joes that might be weekend warriors, or sometimes they're putting in everyday work over in gyms like Stoneway here. So a little bit about what we do. We treat soft tissue injuries, active release technique, some grassed in instrument assisted soft tissue work, adjusting, kinesiotape, and a big focus of our practice is rehabilitative and corrective exercises. So we like to go through one-on-one with patients and kind of give them good, constructive feedback on how to actively care for their injuries and resolve them.
That's awesome. Mm-hmm. Very cool. Yeah, I've worked with Greg, and it's the misconception about a chiropractor is that they go in there, they tweak you, they pop you, you see you later. The uniqueness that I've had with you is that I go in there, I'm probably there for about 30 to 45 minutes, working on me personally, and I go on the floor and do a little PT to kind of help issues that I'm having. But he definitely brings the pain. Yeah, definitely.
Yeah, I've also worked with Greg, and I think that there's definitely a different approach that he and the whole clinic has to chiropractic and working with athletes. But let's throw it back, and what would you say is that major difference? Why is it different going to you versus the traditional chiropractic?
Well, like Scott and Joe were saying, a lot of chiropractic clinics focus mostly on the adjustment, and that's a bit of a standard in the industry. But what we like to do is kind of take into account movement patterns, asymmetries, muscular imbalances. We do a lot of soft tissue, and like I said before, there's a huge physical therapy or rehabilitative or corrective exercise component to our practice. So it's not just lay down, let me adjust your neck, let me pop your back, and we'll see you the same time next week. It's let's actually talk about what's caused these problems and how to correct that, not just treat the symptoms.
Gotcha. So just kind of advice wise, I'm an athlete, I'm stubborn, let's say I'm super stubborn, something happens, let's just say this, something tweaks, something's not right, when do I know when to come in and see you?
That's a great question. I tell a lot of coaches and athletes this alike. It's not necessarily if you hurt somewhere, go see somebody, but competent coaches like yourselves should know regressions and modifications to almost every exercise that you're going over, correct? If an athlete's injuring themselves with an overhead lift, say, and you try to dial it back and regress that exercise a little bit, focusing on form, lighter weight, whatever the case may be, and they're still not getting past that discomfort, it's pretty encouraged to not work through pain at that point and go see somebody. If you can't cue the dysfunction, if you can't cue them through the problem, and make some sort of positive impact on that, then it's time to take it out over your heads and go see someone who's qualified to assess them, diagnose, and treat them.
Okay. Cool.
Do you have anybody that you work with on a regular basis, even if they're not necessarily hurting? Do you think that's positive?
I think that there is a huge benefit to regular care and a little bit of focused rehabilitative exercise. And we see a lot of people that come in for quote-unquote maintenance work. We don't like to necessarily call it maintenance work because it's always working with a goal in mind or working to overcome a movement pattern deficiency. So a case in point is you might see someone with a knee injury, and through assessment, treatment, you find that ankle mobility, hip mobility, and core strength isn't where they should be or where we'd like to see them. You know, initially they're in to treat them for that knee pain, but once that's gone, it doesn't mean necessarily that they're moving properly or that they've changed the way that they were moving to compensate for that knee pain. So yeah, we do see a lot of people that we're kind of working on correcting some of their movement patterns, some of the areas that we like to focus on.
Sure.
Yeah.
Yeah, that's cool. I think that from a well-rounded athlete perspective, myself, it would be fantastic to go and see someone like you on a regular basis, you know, once a week, once every other week, whatever that may be, just to keep tuned up, because when you're training 5 days a week, they may not be big problems that come up, but there's always something that I could get a professional like yourselves advice on,
Right.
and work through those and actually end up getting more gains, I think.
Absolutely. It doesn't always have to be a big problem to go see someone. As you guys both know, little minor problems can stack up and accumulate and kind of become these big catastrophic injuries that take you out of competition or out of training for long periods of time. And that's what we're trying to avoid by being proactive with some of the care.
Yeah, man, I'll walk in on a Wednesday, I'll think that there's nothing wrong, sit down, move around, and there's a lot of stuff wrong where I didn't realize that was the issue, or, you know, because there's no actual pain per se when I move until I adjust or mobilize or do some ART or whatever is going on that day.
Sure.
So let's just say, hey, I walk in, you know, you're being taken care of, there's an actual something going on. Like, what's the process of, how do I know how to pull back from a workout or training in general, or when to just stop for that time being and recover?
That's another good point. To pull back from that workout or pull back from training in general, that shouldn't be something that athletes or coaches are telling themselves. It's nice to have that presence of mind to say, oh, you know, this hurts and it's not going away, it's not getting any better, no matter how many times I hit myself on the lacrosse ball or the foam roller. It's just not going away. It's still becoming a problem and hampering my performance. I think that it's important that if they can't, like I said, modify those exercises, those moves, or focus some self-care and have an improvement, that they go and see somebody that can tell them, yeah, it's probably not the best idea to be continuing to train on this. Let's take it back or peel back the layers a little bit.
Okay.
Yeah.
So pretty much it's athlete specific on how.
Yeah, there's no cookie cutter approach to
right.
say, yeah, everybody that has this owie with this move should not work out. Yeah, there's no cookie cutter way to blanket
That's
everyone.
pretty much the answer that we want.
Yeah.
Too, right? I mean, if you said that there was a cookie cutter approach, then I would be like, well, I don't know. You know?
Well, that'll be the last time we see Dr. Gray in here.
So that's a good answer for sure. What were you gonna say, Scott?
No, I was just say, like, just kind of Joe, and then just kind of in your training career, you know, what has caused you to say, hey, I need to go get help from somebody? And I guess why do you walk in and see Greg over at Kinetic?
So now I would go no matter what. I would just do it on kind of a maintenance schedule, even if I didn't have anything, because I love to even just get down and talk with Greg and be like, hey, this is what I'm working on. Do you have any ideas how I could improve these positions or whatnot? And he'd have great information, and we could work together towards that specific goal. But in the past, it was more like, all right, I've had, you know, a tightness, let's say, in my quad or in my, you know, back or something like that, and I've worked on it myself based off of the knowledge that I have, you know, with lacrosse balls, foam rollers, whatever that may be, even my own soft tissue work, but it's not necessarily getting better. And I'm stubborn, as, you know, all of us athletes are usually, and I think that I can fix it and I can, you know, heal and get everything better. But I would say that in my experience, if I can't get that thing to get better in a week, or if I'm not seeing, you know, progress over that week, then I got to get myself in to see someone like Greg for sure.
No, absolutely. So, like, Greg, just before we close, you know, like, tell us, you know, how can we get to you? How can we find you?
Yeah, that's easy. Kinetic Sports Rehab is an easy name to remember. Long-winded it may be, but it's all in the name. So kineticsportsrehab.com is our website. You can find us on Instagram, Kinetic Sports Rehab, on Facebook, Kinetic Sports Rehab. Are you getting the theme here?
Yeah.
It's pretty easy to locate us.
Yeah.
And on the website you can find the contact information, email address, and phone numbers for each of the individual clinics. We got a great team of docs, an awesome team of rehab specialists and trainers, and a killer front desk team as well. So shout out to the ladies at the front desk.
Katie. Cool, man. Hey, anything before we close, Joe?
No, I thought this was great. It was good to
Yeah,
have
dude,
you.
thanks for
Sure.
coming out with us.
Absolutely. Thanks for having me, guys.
Shout out to Greg, Dr. Thompson, Johnson. Inside joke. Greg's gonna be here throughout the whole entire Open, you guys. So every Friday night lights for the next 5 weeks, starting this Friday, you guys, on the 26th.
Yeah, that's right.
26th, guys. He's gonna be here, hanging out with us, wadding with us, and helping us move better. So as always, we have a week pass, you guys. Would love to have you hang out with us. Thanks for watching, and we'll see you guys next week. Thank you.
Yeah.
See ya.